Welcome to Let's Talk Space Medicine. I'm Kyle Anderson, your medical student slash space nerd host. For your listening entertainment, I gather my other medically inclined space nerd friends to talk all things space medicine. With our powers combined, we hope to explore and entertain the medical questions that stand between us and the stars. Today's episode: space motion sickness, cephalic fluid shifts, and re-acclimation. Simply head spinning. During this episode, I explored the question: what are the likely causes of space motion sickness, and could a surgical intervention be necessary for future Martian colonists? As a brief disclaimer, anything discussed on Let's Talk Space Medicine should not be considered medical advice, and is therefore not a substitute for seeking medical help from a doctor. We are simply interested at entertaining the medical questions in the field of space medicine. When I have imagined people landing on Mars, I have often thought that people would bound out of the capsule, eagerly plant a flag, and probably take a selfie to capture that first moment of the first human ever to step foot on another planet. However, there are serious medical hurdles to overcome from the get-go when landing on Mars. One of which is dealing with astronauts that have acclimatized to microgravity and therefore have to readjust to being back in a gravity well. Indeed, astronauts returning from the International Space Station have seriously diminished motor coordination and are severely deconditioned as well. That often requires an army of recovery personnel to help get them out of their spacecraft and recover safely. When first landing on the red planet, it is therefore likely that there will be a significant medical issue when no recovery team will be there to greet you. When first entering the space environment, there is an acclimatization period where your neurovestibular system has to adjust to your new environment. The neurovestibular system is responsible for our motor coordination as well as balance, and involves sensory organs like the eyes and inner ear, and actually has a very tough time adjusting to the spaceflight conditions. As a result, astronauts can experience what's called space motion sickness, and is experienced in approximately 70% of astronauts, and is perhaps expectedly characterized by stomach discomfort, nausea, vomiting, pallor, cold sweating, salivation, fast breathing, fatigue, drowsiness, and stress in general. It is thought that the cause of space motion sickness stems from either two root causes: sensory conflict and a cephalic fluid shift. The sensory conflict is pretty much as it sounds. You are experiencing sensory inputs from your eyes and inner ear and other contributors to your proprioception, or your ability to understand where your body is in space, that conflict with how you are accustomed to. This seems pretty intuitive, and is probably understandable that you would get motion sick, having to reorient your entire outlook on the world, having other astronauts working on walls and ceilings, and seeing objects not fall when you let go of them. The other probable cause of space motion sickness is what is known as the cephalic fluid shift. This is where the lack of gravity, which normally keeps the majority of your blood supply in the venous compartment of your legs, allows fluid to shift towards your head. If you've ever seen an astronaut give an interview shortly after arriving at the space station, you have probably noticed what I'm referring to, where the astronaut's head has severely bulging veins. And a recent publication titled "The Impact of 6 and 12 Months in Space on Human Brain Structure and Intracranial Fluids" investigated this cephalic fluid shift deliberately. Using astronauts staying aboard the ISS for 6 months as well as 12 months duration, MRI was implemented to observe changes to the brain structure comparing pre-flight to post-flight. The study also imaged a set of demographically matched controls to measure any age-related effects that could have occurred independent of spaceflight. And images were taken of the astronauts' brains at 60 days prior, as well as 5, 30, 90, and 180 days after their return to Earth. And their results demonstrated substantially increased ventricular volume, up to 25% in one 12-month astronaut, as well as significant changes to the precentral gyrus, the primary motor cortex, which is responsible for voluntary movements, the postcentral gyrus, responsible for somatosensation, as well as the supplementary motor area and cerebellum, responsible for coordination, movement, and balance. To compound this, there was very little recovery 6 months post-flight and suggests that these changes may persist. So it seems to me that both the acclimation to micro-G that now has to be undone to reacclimate to Martian G, as well as the changes to brain structure affecting areas known to control motor coordination and balance, would need to be addressed to better manage that critical period of time when first landing on Mars. But what can be done about these medical issues? In earthly medicine, fluid accumulation in the brain ventricles causing an increase in ventricle size is called hydrocephalus and has two major categories: communicating and non-communicating. The difference being the etiology stemming from some disease pathology, which would be communicating, and stemming from a structural blockage, which therefore leads to an increase in fluid, which would be non-communicating. Communicating hydrocephalus is characterized usually by a decreased absorption of cerebrospinal fluid, or CSF, usually done by the arachnoid granulations, and this can eventually lead to papilledema and, in the extreme, eventual brainstem herniation. This probably most often arises in some cases of meningitis that results in scarring of these arachnoid granulations, which decreases their ability to absorb CSF. Communicating hydrocephalus also presents as a normal pressure hydrocephalus, which usually affects the elderly and presents as a triad of urinary incontinence, ataxia, and cognitive dysfunction, or wet, wobbly, and wacky. The medical management of patients with hydrocephalus is therefore usually to remove the fluid accumulation via a CSF shunt, essentially a medical-grade drain for the fluid to drain out. It is important to note that this involves surgically making an opening in the skull and placing the shunt device, which comes with an associated infection risk. While a CSF shunt may end up being worth the risk to combat the persistent problem of the cephalic fluid shift, which is known to cause many more medical problems than can fit in just this one episode, it seems like exploring less invasive measures would be a much more prudent approach to start. One such measure that has been explored is the use of virtual reality to retrain the brain's motor coordination. An astronaut could presumably go through a series of VR simulations when approaching Mars and could therefore be better suited to reacclimatization upon landing. Although this does not address the fluid shifts problem, it could prove a significant benefit for motor coordination and reacclimation to Martian G, and doesn't involve a surgical intervention and its associated risks. So, what do you think? Will the first Martian colonists be able to plant a flag upon landing on Mars? Or will there be days to weeks of reacclimatization? Will a CSF shunt be eventually used to combat the cephalic fluid shift? Or will less invasive measures like virtual reality be the better option? Thanks for listening to Let's Talk Space Medicine. If you want to continue the discussion and meet more fellow space nerds, be sure to check out @TalkSpaceMed on Twitter and the Let's Talk Space Medicine server on Discord. Thanks, and see you next episode.